public when they come? Do they have proper seating arrangement? Do the people out there, are they rude to them? Do you have a numbering system? Because we always have situations where the bullies want to take over. So a numbering system will ensure that everyone, as you come, that's how you will get attention. Is this waiting room area? Is it hot? Is it unlit? And so on and so forth. So those are the things administration on their part must ensure there is a pleasing environment so that when workers and members of the public enter, they are not, they feel that I'm coming to a public place where the standards are high. That would be your responsibility. But you need to support. Because at the end of the day, all of you are part of this process. You're all consumed in this hospital here. And therefore, I would say civic pride must make us want to work hard so that your hospital is shining. And people, you will be proud that you're working. Okay, so would you like to say something, dear?
So what happened to the graves out there, Mr. Demerara? When it rains, and wasn't that shed? You don't think that waiting area is too small? Is it how crowded it is? This one here.
This one here is small. Central, yeah, North Spain would have raised some proposition to the MC part. See,
This is the health center, sir.
Right, this health center, right. This is what I advise her to place in the budget for next year. For extension to the waiting area, because I can also observe that the kind of crowd. It's not,
it's pregnant mothers,
right. DC was also contributing to that because the pharmacy becomes part of the health center. You have an influx of patients coming.
Is there a possibility that now you move into this or it's impossible?
Well, last year I placed it in the budget.
This pharmacy was always here?
But it was never considered.
It wasn't always here. This wasn't always here.
Yes, it's here since I came here.
You came here since last year?
It was last year.
Yeah, it was always here. It was some exception. But the patient said that you could get antibiotic free. You don't have?
No.
You have none? But that's one of the
Skin rashes.
Yeah, I get it.
Yeah, you see, we have some problem with the main one, which is the diamond. They don't always supply the medication. That is why I have to, because I'm supposed to directly order from the main one, but they're not supplying me with anything, so I end up getting from
Yes.
Right.
So when you get a few of them, you cut down.
Right.
So why have main bond not supplied?
I think they're going through that transition
Yeah,
period.
because remember they
Yes,
recently
be properly
moved
coordinated.
from
But I guess they were too tired to put the lights on.
I guess so too.
Yeah, they were too tired. Okay, we notice you have a lot of people there. How long do you take to deal with one patient?
At least about 10-15 minutes.
10-15 minutes. And how much staff you have helping you in this process?
It's only myself. I have Nurse Jasmine, she's a CHW. We have a nurse CHW in training.
Okay.
And Nurse Mendes.
So you have 4 persons?
Yeah.
Okay. And the 4 of you see one patient at a time?
No.
Or when you come, you take the pressure, you
Yeah,
weigh
you
the
have them in
babies?
different stages because the CHW you wouldn't know what midwifery aspect of.
So finally, when they finish all of that,
Yeah.
so all 3 of them operate at the same time, and then you, as the senior person, will then do the final check.
No, the nursing assistants, well, I train her so she understands to operate some of the imperative equipment. So when she finished now, she would bring them across to me and I would just assess the card back to let them go. So try to make it a little bit more easy.
Okay, now how much patients do you, not patients, but how much mothers or, patients, I'll call them patients for now. How much of those you see on a daily basis?
That's on a daily basis. That's on Fridays and then we have antenatal.
Oh, Friday.
Yeah.
And how
Monday and
much?
Tuesday children clinic.
Okay, so Monday and Tuesday, children clinic.
Yeah.
Today is
It's
antenatal.
8-day children sometimes, 6-day, depends.
And for each one of them, how much time do you take?
About 10 minutes.
10 minutes. Is it possible that we can devise a strategy that where you encourage some of them to come in the afternoon, rather than everybody come in the morning, to finish early, you have a crowd, they frustrate themselves, and you overwhelm as well. That devise a strategy where half of them come in the morning and half of them come in the afternoon. Will something like that work?
Well, we start that from Monday. We decide a time system for them.
Good.
So we want to have everybody living it.
Okay, and you think that will work?
Yeah.
Okay, what are some of the challenges you face here?
Well, they got different challenges.
Well,
Plus, the sitting accommodation. Yeah.
I stopped writing, so you're here. So seating, we have that. We were told that a recommendation is being made to expand the seating arrangement. So that is one of the challenge the administrator has, something that he's looking after. What is the second challenge?
I don't have a cleaner.
You need
You don't have a relief cleaner come on Thursday alone.
You don't have
Yeah, and if you come into my room, you're gonna see. You don't have people to when you're ready to clean the windows. It's been dirty for the longest while.
All right, form this because this will breed mosquitoes and flies and worms and stuff. So we want to propose that this is something that is doable. All right. So we're asking you to undertake that.
Yeah, and
task.
then they could fix the gutter too because you notice when the water fall off the pools here.
All right, we start then. Oh, the gutter. Your gutter.
We have one more thing. We have a little problem with our televisions. We have lots of slides anymore.
I've stopped taking notes. Who's taking notes? Problem with the TV?
Yeah.
I want you to pull together those little things that are doable. There are bigger things that we may not be able to do right away. But these little basic things, like the place out there, this. All right. Mothers, have you all been here a long time? Is there a system where you were given a time which you were supposed to be here?
Only we start that now.
Okay, so how long you've been here? You have been here. What happened with the tongue? The cat bite off the tongue? What are you waiting for from outpatient? Outpatient waiting. How much of you are from outpatient waiting for drugs here? Okay. All right. So, do you have a system when you come for your drugs where, based on how you come, you hand in your card?
For little child, 1 year old.
Where are you buying it?
Where you have a
Oh, buying it. So I thought buy it here. You don't buy it here.
No, you don't get the deed.
Oh.
You got to go to the pharmacy out on the road.
Yes, I give it to you.
Only camera नहीं patient है
So you work so you get drugs from
I see, no, I see.
this problem of the hospital. Let's go somewhere in the cold shed. We don't have no fans. The place is very hot. There were 3 fans there. They're not working. So that is something that we need to do. Either fix it or let's recommend that they get new ones.
But before we go forward, you see, the thing is, the center has a department of the that makes all those representations, apart from the administration.
So
from
who's
this
the
hospital.
department? Okay.
That is the senior health visitor.
Miss Johnson. Miss Johnson.
Yes, she has the administrative ability and responsibility for this.
But please, can you write that, Ms. Johnson, who is supposed to be looking after the things for that, not Mr. not the
And
administrator.
it was on my accord that I made representation to the Ministry of Health, and we had that we had the ceiling fixed, the lighting capacity fixed, and to some extent leakage and cupboards also was redone. So I have done my part for the health center because for it as being in the hospital. You understand?
Okay, the next thing. We were thinking, just give me a second. They're dead, is to put some ice on them and something. Even if you have to make a makeshift arrangement such as that. Is there somewhere here that you can get ice within half an hour?
No. I must explain to you. kind of important because concerning these, because of the hospitals have an inpatient capacity. Legally, we cannot keep anybody or any patient that would have come here and died or.
So why would they put the child in the fridge?
That was really an unprecedented move.
By who?
Taken by the training doctor.
The trainee doctor?
One of the interns.
So the training works by him or herself?
No, he works under supervision of that would be Dr. Fu.
The food.
Yes. And I have since written to these individuals, all of them, to the director, Dr. Fu, and the young doctor. He gave me a report regarding the incident because it occurred in the night. I think it was approximately around 8:30 in the night. They have since refused.
But where is the refrigerator?
The refrigerator is not is in the emergency room for emergency drug storage.
But how can you still use that refrigerator after storing the remains of the body?
Well, they can clean it.
It's not
Fumigate it.
yeah, we did that to the best of our abilities in terms of what is available to us for it to be cleaned with the necessary chemicals and so forth.
But Leonora has a mortuary.
Yes.
So then it can be used as a morgue.
It cannot. It doesn't have the capacity. I mean, we have a building saying it's a morgue. But if you go into that building, it has nothing to put a body.
You have the market?
Let's go see it. What were you because they usually cut it Leonora?
Yes.
So what are these?
This is what was in here.
Well, we were just told that they did not get drugs. When the last did you all get drugs? Mr. Prasad is here. And we're just, by the way, we're in the morgue at West Demerara, yes. The morgue in which you have a lot of dead drugs. They're not people, they're drugs. The whole place is filled. I suggest you all should come and decide what to do with these things. A whole lot of drugs here that's expired. Leonora, I'm at Leonora. Yeah, so I'm gonna raise this matter at the place was poor. That the Cubans, they had no system. Right? So now as of this year, you have Ms. Ward who is in charge. They are going to write up the CRIF and based on the needs on a 3 months basis on what people need, that's how you will get your drugs. So he believes that this situation will kick in effectively from next week because by then they would have received the CRIF and then they will be sending all the drugs.
But this we have
has
to
been
get
here
rid of
since, no, hear what he says. Since 2008, the situation that we have referred to had existed. You said the reports have been sent in, so
Yes.
all of this now should be taken by
Right,
the food
right,
and the
right.
drugs and analyst department,
Right.
the food, drugs and analyst department, who will take responsibility to get rid of this.
Yes.
And so this is your morgue.
Yes.
And because the morgue is now with dead drugs, you can't use it effectively. So we're going to ask that all of this be done very quickly so that the drugs, the morgue, if there is a need, you can utilize the needs for it. But you will need here what? A refrigerator?
Yes, you need to have it a refrigerator installed.
But they never
Mortuary
never
capacity.
stored at Leonora.
They never stored it. What has
Stored.
happened if a person dies inside the ward, you normally bring them and keep them for a couple of hours until
The police comes.
the police, if it's police or whatever it
Or
is,
the parlor.
or the parlor, the horse, they would come and collect the body and take it to
That's
the
why because they used to be cutting at Leonora.
All right.
long
Okay,
ago
let's
days,
let's
in
move.
in the 80s when I worked here, right? You used to get the persons used to come
Come
from
across,
West Dem,
yeah.
and they would do the postmortem here, and people would collect their bodies
Yeah,
from
yeah.
here. See, no, that is a pharmacy. This is a pharmacy body.
Well, because we have to be pulling these heavy jars over and over to find we use the system again. We going over back to the same system over and over again.
They're not installed in the refrigerator?
No,
No, they're so according to a number.
And then hair
Alphabetical.
transplant. So as you come and you don't have the ID card, we have to take back all the information back.
Yes, we're appealing to the patients then when they come to hospital. So please walk with the
Yeah, but when I go home, I don't find that thing anymore.
Because you're putting it up. Because if you go at the bank, you know you gotta walk with the bank card.
I think ICU trainers at this part used to work, but
This brigade we have here.
But don't you see?
But you know, because they don't have a, you see when you got an ICU, you got that. You understand?
You have to have a
A theater, operating theater. Because if you got patients with blood problem in the ICU, you have to rush them to West End.
But West End is not far from here.
Yeah, but
How much is distance are we
Western
talking
doesn't have
about?
an IC when they have a theater, so it's a
Probably
I see.
probably we will talk more to the director and she probably even text.
So this should go to Wednesday.
This should have been
This should have been, so there is need to transfer the ICU from here to West End.
right.
Because I was just want to ask you if you don't think that Leonora should now become that full-fledged hospital again. First, Leonora was a
The
hospital.
problem you have is your
Right.
staff.
It's just a diagnostic center, but you have lots of the amenities that the hospital will cater for.
In the 80s, I was staff nurse nearby here. We used to do numerous deliveries upstairs.
That's what I mean.
And we used to house, this used to be the male ward, where we used to have 8 patients. Female ward used to have 8 patients, and we used to do a lot of deliveries upstairs
Okay.
as midwives. And we used to work
And
there
best-
until 1996. I worked here 80 to 85, and I came back here 92 to 96. And we used to do deliveries.
So when we stopped doing that,
I think somewhere along the line when they fell short of midwives.
so that there's a
Because they
staffing
don't,
problem.
they don't have midwives actually.
But we have quite a few midwives, aren't it?
I'm the only midwife here.
And this and nurse.
No, I'm the only midwife here.
The hospital.
And for the hospital and nurse paying for the health center.
So you have 2 midwives.
Wow.
But you can deliver babies here during.
If they come emergency, I do the delivery up to Friday gone by. If they come and they're ready to deliver, I deliver them. I will record my chart and I
Or
will
if
send
not,
patients to them.
if not, they can be delivered here, you send it to
I
us.
normally would, if they come, I would normally examine them. It depends on my examination, and so I refer or keep them to the delivery.
Okay, so we're asking for a consideration, one. So if we can't have the ICU functioning here, then it needs to go to West, where hopefully they have the staff, and if not, we're saying that do you need to shore up the staffing here so that at least you can have ICU in terms of care.
But she said
Maybe
ICU
somebody.
theater.
But
No,
ICU to remove is not the building as it is, it's
No,
just
it's just
equipment. And how much equipment do we have? Because majority of them have been sent to other places already.
So you need to say
There's
that
a
you don't
portable
need
X-ray.
to say that you have an ICU. You don't need an ICU.
You don't need an IC here.
Uh-huh. Because in an emergency situation, you need to stabilize a patient if he comes with a heart attack. You all know what is.
They normally do that in the
Right,
rear,
so
and
there
in
is
Jamaica
no-
they used to have ICU.
Okay, so you're still not getting the support of the.
Well, now there's a new management, but I'm not getting the opportunity to face with the management.
Okay, so you know what we can propose? Sometimes the bureaucracy can overwhelm, but I think since there have been problems, they are at a point where things are improved. There is a need to have dialogue between the West Demerara, the regional, what you call the best people there,
There's a rarity.
along with the RHO.
Yes, because
So,
the RH was here last
There is need
week.
for that.
I asked only last week the RH was here along.
And I think RH made a commitment
along with
and
the
all of that, you
intercoordination
know.
from Ministry of Local Government and Ministry of Health. And in that meeting, I asked the REO if I could meet with him once.
Okay.
With himself
So
and
here's
REO,
what-
and he declined.
Okay, so here's what this visit will recommend, and we will write to that effect. We will recommend that based on our visit here, we believe that there is need for a meeting with the administrator and other
RHO,
staff and
yes.
RHO, not only here, but for that regional hospital in Best, along with the REO.
Right.
The REO, the RHO, administrators of both institutions.
But you all don't have a monthly meeting, RAC?
we were never invited to that meeting.
Okay, so
I wrote RU recently.
So out of this visit will be this recommendation
Yeah.
that the monthly meeting should occur.
Yeah, you have health, education, agri, all the agencies don't meet monthly any longer?
At least perhaps they met.
Let's not confuse it.
No, they probably
Because
meet with RH.
when this big meeting, if they get sidelined, they need.
Yes,
to be
remember you
on-
need a representative representing
we
health
need
alone.
a specific thing where their RHO, the REO, and the two administrators to meet with respect to resolving some of the initial difficulties. I think that's what we,
And
perhaps at a later stage, they can meet at a bigger level, but
Mr. Paul
right.
also, I don't believe the senior officers there. I mean, I'm speaking based on my experience. I've been here for 5 years. I've worked with the other administrators while they were going off. I was still there.
No, you worked
At
where
West
for
End.
5 years?
I worked at West End and Leonora 5.
But in administrative capacity, 1 year.
Yes, at West End, yes.
So let me hear your
And
perspective.
I don't believe we're the officers that's in charge right now. That's how it's a matter of my professional opinion. And they have to take into consideration, they got to put the policy of the hospital. Most of them, they're not cognizant of this act. And this is where we are going wrong in some part.
That's the
That is the health
Public
facility,
health?
the
The Health Facility Act.
license act, right?
the licensing,
Right.
health facility
Because
act.
this act will tell us how to manage your hospital. It has everything. Alright? And I don't think you're following it. Many times we made reference to it and nobody knows about it.
Okay, so we also proposing further that there should be at least in the next 3 months or within the next 3 months, the need for senior staff of West Demerara, inclusive of all the cottage,
Yes.
whatever, to have a workshop on the health
Facility license.
health facility licensing. So that's a solid recommendation we're making. And this is not only the administrator, heads. So there needs to be a one-day session
Yes.
in which all the heads of department in these facilities are involved in a training session to discuss this health facility.
And under this act also, we as administrators we were bound to establish an occupational health and safety committee also in the hospital.
And also the need for the health and safety occupational.
Right, that is not
facility.
existing in either hospital.
Either hospital.
Yes, it's just myself and Sister
Occupational
Chan Rose who would have gotten training in that area. But we took it upon ourselves in this hospital to execute that function.
Occupational safety and health
Yes.
facility committee.
Right.
Occupational safety and health.
But we need to establish I could not establish it here because once we have so many financial challenges when I came here. If we put the meeting and they made recommendations, who are we going to go to? I had an RH who was not responsive. The regional administration fell aware of that.
Who is your RHO
Former RH, that was Dr. Ravi Prasad.
and who is your present?
Dr. Coleman, who was she's much more cooperative.
Dr. Coleman?
Working excellent. Yeah.
Okay, so, all right. And how long has Dr. Coleman started?
She started
Not very
recently,
long ago,
for 2
recently.
months.
No, more than 2 months.
She's acting, right?
Yeah, she's
She's
active.
Well, you know, now it's good strike while the iron is hot. New people, in new rooms we clean. So that is what you probably need to do. And you know, it's a problem when the people have been in the system for a long time, they become very complacent and they don't want to step out of their.
And
There.
there was also
Comfort
a
zone.
mandate from the minister also then Dr. Ramsami. I mean, it has to do with the license act because we as a hospital we supposed to make that 5-year plan proposal, 10-year plan proposal. It was only myself and Dr. Ratsing, the former medical superintendent who started to work with it, started to consult. Eventually it fell apart. Dr. Singh leave. He spent about a year. He left, and this was myself alone. And the other officers were not. I don't think they were interested.
So if I would say before even if you think of a 5-year plan, you need to have a year plan as to what you want to achieve.
Well, the year plan will be inculcated in our budget.
Yeah.
That's that. But we need to have a 5-year plan to where we go.
All right, so I think at this point in time, we have listened to you, we have also made observations, we've heard, we've seen, and perhaps it is now the best time to work to bring closure for this visit here. We have made some tentative proposals that we talked about, those things that are doable within the shortest possible time, and we will send you the minutes of that meeting, so that I think before we will send you the minutes so that you can see the recommendations that are made. And these would have included the need for an inquest, the need to expedite the difficulties that you have presently experienced with the drugs here. We also talk about these meetings with the RHO and the REO, with both hospitals. We're also talking about the training program for people to understand. Those are some of the issues that I've seen. Then we talked about the need, those small things now that are doable, the need to have like a load of earth
Yes.
to fill up the holes. We're talking about the need to expedite all the drugs that are there. After 5 years, you need to dispose of them. I think the 5 years soon will be up where they can come and
We
do
don't
an
have-
inventory.
We also face a lot of challenges when it comes to emergencies where we have to make contact with SM hospital because we don't have a cell phone access at this hospital. And that is
Oh,
a
you
challenge.
can't, as the administrator can't make cell phones from calls from that home?
No. I don't even have
So
a
he needs to have a cell phone
I don't have a direct
access,
line either.
and there is need for the administrator to have a direct line. Those are things that we need to have. We need to have the funds for the areas in which the maternal health people, we need 3 funds there. We need the director to have his AC ready. Those are the doable things. And you know what we need to do, Mr. Adams, out of this visit here? Me and you will go and meet the REO.
Yeah.
Right? That's the next step. And that's the kind of thing we need to start doing. So we don't wait to put the report to Parliament. We will then move a step further to meet
The person directly in
to
charge.
say, these are our findings. We want you
Because it
to.
can be done, the region has electricity disconnected.
And also to the Ministry of Local Governments has to be cognizant of the policy administration.
So,
because
yeah.
Not only this one,
sometimes they
not-
don't
not only
really
this is not
understand
working,
that the
popularity.
hospital has to be in a prescribed manner for a normal day's work. If you have an easy functioning emergency room, that can be very unhealthy to the staff, the doctor, and to the patient or the government.
So this is the only thing that is changing. What you say this is not the only one that's not working.
No, he has several, I think.
Some in the rooms them that I were taking you to,
AC in general.
Yeah.
So how many lock up in this crash place and function?
Well, I
But
have
here
a-
you used to have an ambulance. What happened to it?
It was seconded back to the hospital because why? Shortage of drivers. We don't have enough drivers to facilitate the 24-hour service, even at either hospital. So what we did, we centralized that. And bless them, and we will call when necessary.
Yeah.
I
Well, I
I-
think that's fair. That's
Yeah,
reasonable.
that was done under my time.
All right, I think we've seen enough, we've heard enough. Is there somewhere else we can visit here that you think we need to see? Mr. William is a member. These 2 colleagues here are from APU and I'm from the PPPC. Okay, we have other colleagues who should be joining us. Somebody from the AFC and another member from the PPPC, Dr. Bassad. And then we also have members of Parliament, they're researchers and they're clerks who are working, they're PR person. And then you also have members of the media. I don't know how much of you know of our social sector committees, but since 2003, we were established by the Constitution and we have a mandate. And actually there are 4 such committees. There's the foreign services, there is the social sector, there's the natural resources and economic services. So we have a system whereby we rotate. Every year, the chair rotates. So last year you would have had Ms. Amna Ali. This year is me and whoever else. And for all the committees, they do the rotation principle. So when we're here, we're not here as party representatives. We're here as the social sector committee and we speak with one voice. That's how we operate. I must tell you, we've never had an occasion to take a vote on any issue. Just goes to show that we work with the consensus. And so we try to work so that we can arrive at consensus decision making. Now, our committee undertook to have some visits as we usually do. It's not new. We can investigate based on our mandates. We can look into all the areas that fall under our purview, such as the Ministry of Education, the Ministry of Health, Ministry of Housing, And we have a number of other areas that we can look into areas, make recommendations, and so report to Parliament and provide short reports and so on. So our meeting here today is based on the mandate that we discussed at our statutory meeting, in which we said that one of the first things we want to do is to look at the hospitals, because it's the first time this new committee is operating. My two colleagues here are new. I think they're both new parliamentarians in this regard, as well as being new on the social sector committee. I'm an old hand, but the others are new. Now, what is it we're seeking to do today is we wanted to visit the hospitals, that is Leonora Cottage Hospital, which we have just completed. Now we're here at this point in time, and then we'll be moving on at 2:30 to the Diamond Hospital. Having visited Leonora, there are some issues that we want to bring to your attention. And we know that now Leonora has to work in very close collaboration with you. Now the first thing we recognize that we notice, and the patients who were there confirmed that there were shortages of drugs, and I took the opportunity to call Mr. Passat Diamond, and he indicated to me the new procedures, which will be that the drugs will be sent here and then it will be redistributed to Leonora and elsewhere. So I want to urge you that as fast as possible, before next week is over, that the drugs they need will be there. The guys heckle us and said, well, I couldn't get no insulin, and the mother said she couldn't get this or that. That's the people sitting outpatient waiting. We had the opportunity to visit the bond. You all will have a chance to speak. I'm outlining.
Okay, just asking for issue by issue. If you don't want to give a response.
We will. I haven't finished with the drugs. I'll come to that. Then we had the opportunity to visit the morgue, supposed morgue. There were lots of dead things there, but they were all dead drugs, expired since 2008. Right? Now, the reason it happened, we were told that there were Cuban doctors who were in charge of the pharmacy as well as the place. There weren't adequate systems in place. As a consequence, the grift, is it grift? Crib. What is it? Crib.
What's the
It's a
acronym?
requisition voucher that you get sent from the hospital.
Okay, the CRIF were not being written up. And because of that, they were just requisitioning drugs as they like, willy-nilly. And because of that, a lot of things, you didn't have the number of people to utilize the drugs. Somebody smart would have called up and said, look, we have an abundance of drugs here, and based on the amounts of people that you would have been seeing every month, you know that this is the amount of drugs that you were supposed to requisition. Unfortunately, it did not materialize, so we have an abundance of drugs. That's the first thing. So we can start dealing with the first matter, that's the drugs. And then we will deal with the others. And then we will come to this institution here, where we will do a visit. We'll ask questions. If we see members of the public, we talk to them. We'll talk to staff, so we don't have much time. So let's move quickly.
Right, so welcome you members of Parliament and the others. Now the one with the drugs. And secondly, because of the timing, I would not have shown this disrespect to you by not going with you at Leonora. But we thought because of the time we thought from here to Leonora, we did not realize that you were at Leonora. And I apologize for that because we didn't know there was a genuine mix-up with the timing. Genuine mix-up with the time. The drugs. At our last retreat, we raised this issue. The Ministry of Health, while they have the drugs, do not have the staff to pack it. Our cribs, our requisitions were there on time, and we would have to send people from here to assist, to just pick, because we can't do the work. But the Minister of Health acknowledged it, and there's a shortage of staff, and that's the reason why. Whatever we have here, and we have whatever adequate amount we have, and then also leg one and we can
Okay, I want you to stop right here because we're going to make a proposal. Suggest that you can very well utilize those along with what you have to do the help to make sure that the bottleneck that we are now facing, Because massa cow, massa bull.
I agree with that.
And therefore, all we need to do is to have an arrangement whereby, however you want to do it, you make your decision. So that collaborate with the administrator there and say, you can call our names, that we have recommended it. That because there is a shortage of drugs, let whatever they need, let somebody go here, and somebody at the top there will supervise it to ensure.
That is once.
That's a solid decision.
I agree.
Proposal.
But that is once we can go there anytime we wish. It's when they give us the time, then we can go.
Because they supply
so
the entire
they
country.
have the entire area.
No,
So we
but-
just can't say, well, I accept it, that we need to collaboratively handle the situation because we've been having people from there going, but we can only go when they will accept us.
Well, here what we want to do. We want to speak, we will speak to Mr. Prasad. I've spoken to him already for the day. And when all of this is done, our discussion here as well as Diamond, I'll speak to him for the second time. Because it is my belief that we need to resolve this problem for once and for all.
Because we have the drugs, we have it. It's not nationally short. It's just that getting it to the region.
Yeah, so with that proposal, I don't see, if it is managed well, we shouldn't have a problem. Shame it is that all the monies that have been spent on drugs that have been expired there, whereas members of the public who need it couldn't get it, but that should be something of the past. It mustn't happen. So that's the first issue. So you have come up with a proposal, and we agree with that. Now there's some other
The
things.
expired drugs also, we want to do. In fact,
At Leonora that is not operating because they don't have staff. But you don't have an ICU here, but you have, what do you call it, theater.
yeah.
Now, don't you think that we need to regularize that situation?
Yes, because we have put in for
The
for us to
necessary
have
equipment?
the ICU here.
Okay.
And we have that in this year's budget,
All
to
right.
have an active ICU.
But Leonora has equipment.
They have the
Some-
equipment because that was
some-
because Leonora generally was a diagnostic center, and they have some equipment. But we are stocking, we are just equipping this here so that we can have the ICU functioning here.
Okay, there are some other things we noted, and we want to deal with Leonora since we come here and you have supervision of Leonora. I do believe, and this is something we'll have to raise at another level, I think there is need to have an impress, but an impress will need someone and place to do what is required. But I think there should be collaboration in which, come on,
Good afternoon.
come on in.
Sorry, late.
There's a chair here, come sit.
Yeah, thanks.
This is Dr. Prasad. Can be fixed. Then there are a number of ACs that are not working. Well, how I would say, I'll address to Dr. Coleman. This is something that needs to be revisited and resolved. The administrator, AC is not working. We have seen the yard itself. They are right where the maternal health. There is a puddle, or the place is low, so you have a whole lot of water. So you'll get mosquitoes breeding ground there. And all it takes, perhaps, would be one truckload of earth to solve that problem. Let's solve it, please. Let's solve it. Those are the doable things in the short term that can make people's lives easy. Then what else we have there? That is
It's about emptying
the emptying the morgue and remove all, because it's after 5 years, you have to get the the audit department as well as the food and drug people to come and resolve that matter, so that all the drugs that are not being used can be removed, and you have a morgue in case you have an emergency, you have a problem where they can put a dead body there for a few hours, because it is a hospital. Somebody may die of a heart attack, and at that time they can't get a taxi or they can't get nothing to do anything, so it's a short-term arrangement. But really and truly, to have a place that has drugs, so much drugs that has expired, is not a good thing for anybody working there. So they also have problems with staffing. What we have discovered, that there is an attitudinal problem with the staff. Some of them come to work late. When they come there, they don't want to do their work. And somehow we're unable to discipline them. Now, we advise the administrator that when people don't do their work, write them letters, put it in their personal file, and you take action. You see, failing to take action will allow those staff members who are in discipline, they will allow the breakdown of discipline, because others will see that it's okay for me to come late, it is okay for me to eat on the job, it's okay for me to text whole day, it is okay for me to use my cell phone and have the members of the public there waiting. It is not okay, and we have to put a stop into it. So we want to encourage all personal files for those people who are in discipline must be dealt with. You just can't leave them hanging there. That is something we are recommending very strongly.
I wish
The section that we're
from the etc. We've been repairing those things solves in front, and the fluctuation in front. And the administrator can tell you this, that whenever you request that we do repairs to the air condition, only last week we did the one in the lab, the next day they transfer everything born. There's a serious problem in this region with fluctuation of current, and doesn't affect them, especially in the condition unit. We talked to the water leaders, they admitted there's some way that I know the door can go and solve it. We should do it. But then a lot of things there, they're raising there with staff and so on, has something to do with the administrator there. There are little things that you're raising there that should not even reach here.
No, hold on.
That he has to
He
take
did
some
not raise these
responsibility.
things. We observed them. He didn't raise them. Let's make it very clear. Before we even had the discussion with him, we went visiting and we saw, and we had meetings with the staff.
All right, so open the HR to
The
the door.
administrator was the last person we spoke to. All right? So he didn't complain about
Right,
it.
but what I'm
We
saying-
saw, and we are saying that it needs to be fixed.
Based on the observation we acknowledge,
Yeah.
and I would have thought the administrator would have taken some of those minor decisions.
But the administrator
corrected.
does not have a cent. There
Yes,
is
but-
no money. There is no
Because
impress.
the system cater for here, whatever you need, through communication, and the impress is here. That so much is
So
impress here.
Let's ask, when did you buy some funds and send it to the
Well,
Leonora?
based on the budget, we can buy funds from the budget. This year, we are purchasing 24 funds. We do this based on the requirement from these hospitals. Leonora is one. We have now what that's what we're doing there, just went through evaluation
Okay.
for the fund to replace those. We are aware the washing machine is a
We
heavy
need
duty.
another one.
A heavy, that's not good. You need a heavy duty, it wasn't budgeted for it, didn't we? So I'm trying now to get from savings from this year's budget to buy a heavy duty machine. Not a regular type. It's a heavy duty machine we have to get. In the interim, what we have done is to the laundress from there to bring the clothes, the bedding, the linens here at West Dem to wash, because you know you can't use their hands or something. So we bring it, and that we've been doing that to offset the charge of that went up.
Me and my
You don't have a division in terms of trauma and other?
Well, that is supposed to be holding and this is trauma. But now with the new system implemented in Georgetown Hospital, whereby the holding and trauma room is one, we're trying to follow the same one so the 24/7. So that you have, it is catering for about 7 beds running here.
To the wall?
To the wall, right? This is more holding trauma, sexual trauma
Trauma on this
on this one side. And featuring probably 2 monitors up.
to let the officer know what is needed.
So she is now in the center of the park.
What happened to the RPS? Some of the patient know of the Georgetown or something?
You're referring to the biochemistry machine. That is actually trial since last year.
Yeah,
That's the
that's
biochemistry.
So which test you can do? All?
No biochemistry.
So all have to go down to top? And how long you take to get results?
They go back the next day.
It's something that the region is already trying to see how they can resolve it with Meditron. Because this machine is sent to be repaired. It's back. It's back.
It's working?
Is it working?
They're setting it up now.
So it's finally back.
Because I got that complaint on Monday.
It
So
came back
we may
this
be able to.
and they brought it back on Tuesday.
The senior citizen was complaining that she had to come to Brest, then go to Georgetown, and then go back the next day for the results.
To Georgetown?
To Georgetown. She's 18. So I'm like, I have to speak to someone from yesterday, but I just remember. So I can turn all this back to so where's the next one?
This is basically the emergency unit. So that is where the breakdown is.
But that's the regional administration,
Not cabinet, the decision is already
they made. I told them that.
So it's to
So
put
it's
it
the
in
regional
effect.
administration, and we have the deputy regional officer.
So
But why is that?
So we can put that, we have that somewhere there. So
because over time payment will enhance change our
but I told them that people get
Because you
paid,
have
they
the
go to
human
work.
resources
to cover the
to
service.
cover the services.
Why?
But even for everything, right?
PSM can actually put it in effect.
Yes, huh?
They cannot give us no objection.
There's some
No matter if cabinet give approval, PSM has to write.
so they have
Right?
this.
It's just for the region right PSM.
No, you know,
And
one
ask
of the
them to-
one from public hospital
Where you can employ
semi-autonomous,
people.
and have the institution function on its own.
One of the issues we're pushing to have is for the RU to have the whole employee scheme one institute.
But that should actually be clear at the hospital,
Yes,
not necessarily the RO,
aides,
right?
laborers,
You see, that's the thing. If the hospital becomes less independent, then we can actually pay our staff all the time. We have a
You have your board,
department,
you have
we have a
everything.
board, medical board. The hospital is managed by a medical board. MSC manages the hospital. You have
Because
a
the
CEO
region has a lot
instead.
of other things to do, so the
Yeah.
hospital can sort of.
So
And your matron, is she the woman is she still on?
the matron,
She's off. She's on period time.
yeah, she's off.
But
So
was never paid the acting allowance sometimes she was acting.
I think that's perfect. That's definitely.
No, she complained this morning. I only asked her the fee. She complained this morning to
But see, those are things in the hospital function. It's a big hospital. It's the third largest hospital for the country. The third largest population. It needs to function with some amount of independence. If you have the correct structure, the transparent process, you have a CEO, you have the medical director, you have director of finance, you have the necessary persons, and the institution can, if a phone damages, you can replace it tomorrow. Maintenance, the problem you can have maintenance.
So decentralizing the system.
I think the Demerara Regional Hospital has come to the point that it needs to function, just like what they would have recognized the Georgetown Hospital.
It's too big a structure to have
Sure.
to depend. We
To
know
one
that
region.
it's big.
The region is big, and I give compliments to DRU and RU. They're working very hard, but it's a big region to manage, and to manage a hospital at the same time.
Yeah, they have too much work.
That's what I'm saying. They have too much.
They're just behind of the building
This
there.
is sharps and everything.
No, the sharps, they will carry, they have the incinerator there that they will do it. And many times you have to remind them when to come on the ward and remove these sharp boxes and your fill and so. And in front of the building, that's where Uran company is, this stock is, garbage is being stored in front. There is an eyesore to the public. Soon as you come in, you see that garbage here is not removing in a regular basis. Our electrical problem is very poor also. We don't have enough points on the wire. Well, these are some of the concerns we have discussed with our administrator, but it's not moving as fast as it should. Because you have equipment to work, but to get the point to work, you cannot work. The several lights that is not functioning right now. In the night, it's terrible for the nurses to work and to give effective care. Okay, concerning nurses' security, that is very, very bad again. We are not safe.
You had any incidents?
Many incidents.
Here to give me a few examples.
For instance, at emergency, where the nurses face the public. Recently, 2 nurses was on duty and 3 male came in, and they came as patients, went into the wheelchair, and they pushing in their patient inside, passing the nurses at the triaging area. And the nurse, they stop and they ask them where they're going, what's wrong with them. They still continue to pass. So the nurse decided to get up now and say she's going and call doctor because the security wasn't there. So while she was going to call the doctor, the same guys, they went and took off the lights.
Up the bridge.
So that was a real chaos there the night with the nurses. Then they took off the light.
They didn't harm anyone?
Dr. Fu was, no, they didn't, because Dr. Fu was on call and nurse eventually get to reach with Dr. Fu and they come out and then they get the lights on back. You have patients will come and they will target nurses out there, threaten them. We have incidents where on our walkway, as usual, to go out to go in and out, traffic in the night on the night duty, nurses was being attacked. Right? Well, administrator knows about that. They are trying in process to make that a little better. Our security, I think they need to be more firm and more serious about their work because people come in and out of the compound. One instance also I encountered while I was doing one tonight shift. A patient, which I say a psyche patient, he came and he was under the mortuary, wrapped up with a blue disposing towel, and he lay down there on the trolley. And we were thinking, is that there? I thought it was a dead person there. Somebody, the attendant take the dead person there. So I went to the attendants. I said, why y'all leave the body outside? Why not in the mortuary? So when they went to upload, they said they didn't do that. So when they went now,
the man from the dead.
And not just that, he had a cigarette smoking and cover up, which could cause fire. Right? Okay. Well, facility for nurses like toilets and so is not is poor also. Nurses, they are entitled for 3 hours rest. They are also entitled for the lunchtime. They are also entitled for a tea break according to the public service rules. Sometimes it's impossible. Whereas like emergencies, impossible.
Because why, you're short of staff?
Yes, because most times you just have 2 nurses on duty and one alone, many times when you have cases, cannot handle the cases, right? Maternity, sometimes no rest at all for the midwives and so because most times 1 or 2 will have. Okay, but where I'm coming at is the time, the place where they will have rest.
There's nothing?
No kind of resting place are being provided for nurses. The nurses, they have their ways and so there are sometimes you'll find nurses do wrong things, we encourage them and so, because one of our sore points with nurses is a lot of sick leave and message ill, which is having the hospital in chaos, right? But we're working with that by encouraging them and so, right? But I think we need a more appropriate resting place, covers to secure their things when they come to work. They need that because we had incidents where nurses and doctors lost their phone, their money at emergency because no place to store their things. Right? So they need their personal cupboards and so forth. Those things. Some of the problem I have we're concerning with medication. We are not getting some medication on regular basis. The hospital, like for instance, antibiotic injections.
Why is that?
But Dr. Slan, some of the issues that were raised,
those are what we would have
issues
discussed.
of privacy, functions well. I think I need
So the
TSM.
problem is really the attendants taking the stuff there.
Probably does with this issue.
And we still throwing it at the back.
When those recommendations are made, then everybody in the public will have an opportunity to see them. But whatever, and the visit that we've had today, whatever we can do in the shortest possible time to alleviate some of the challenges, we certainly will do that. But a lot of other things will have to remain where
the health authorities as well as the regional authorities will have to collaborate to work to resolve some of those issues.
Okay, and what are some of the most common issues faced by these hospitals?
To my mind, it has to do with firstly attitude of managers to their respective jobs. If you look at this place here, the buildings are fine and everything seems okay on the surface. But as you get into it, you realize it's a management problem in
Administration
in the different areas. Because you have some people who are doing better than others. I think it's a lackadaisical attitude. You've been working in the same environment, you don't see there's something wrong with the way things are. And the fact that we're coming here as visitors, we're seeing things that need fixing of these things.
And how soon before the committee gives feedback on the report?
Well, we meet every month, and at our next statutory meeting, we will be putting up our report. There are some things that we don't have to wait on the annual report. We can write letters to the authorities based on the findings, and I do believe we may have to do that because we cannot wait for an annual report. That will form part of the reporting procedure, but there are things that are needed to be done in a timely way, and we will make recommendations based on those.